Let's talk about when it's time to seek out help from a chiropractor or a physical therapist, because there are a lot of stretches and exercises that you can find online that you can be fairly effective in treating a lot of the stuff that you have pop up on your own at home. But ultimately, what you're paying for when you go see a physical therapist or a chiropractor is not necessarily the stretches and exercises. It's the ability to assess a problem and figure out what stretch and exercise you need to get better as fast as possible. Now, as far as what you want to look out for, as far as practitioners go, you want to find somebody who's going to get the motion back in a joint, get the muscles to relax, and then utilize an exercise to give you full control of that joint. Now, I can't speak for physical therapists, but for a chiropractor, some of the red flags that you want to watch out for are a really quick exam. So if you're just sitting in their front office for 10-20 minutes doing paperwork, and then you go back to the office and they do a 5 maybe 10-minute exam, that's a red flag. Another one is if they're doing one of those flying 7 5-minute adjustments where we're throwing you on the table, throwing you over to the E-stim unit, and then throwing you out the door. Really what we're doing is we're just popping your joint and hoping that your muscles will take over when you leave the office and do most of the work for it. And hopefully you'll get out of pain within like 36 or 42 visits or whatever they're prescribing. So the reason why that happens a lot of times is money. It's a lot easier to rack up a lot of cash if you're charging $75 for 10 visits in an hour, as opposed to $250 visits in an hour. So it just all comes down to money. And I know that because being in practice for 10 years, working for 6 different bosses, all but one basically told me in the first week, actually pretty much word for word the same thing, is I used to do 20 or 30-minute visits, but then ultimately fell into the 5-minute visit because that's how you make money. But it's not patient-centered care. So you want to find somebody who's patient-centered care, who's going to spend the time with you to actually treat every aspect of that problem by mobilizing the joint, by getting the muscles to relax, and by getting that joint control back with an exercise, so your body knows what to do when we let you walk out the door. But as far as billing goes, if you guys have any other questions about what we're doing with billing, or any other questions about the therapy process, or what other red flags to watch out for with a chiropractor, drop me a comment. But like, subscribe, follow, and pour more.